Okay, well, hello, I'm Carolyn, Trichologist from Absolique Hair Health Clinic. We're coming back to you today with a bit more information about PRP. It's something interesting that we're using in combination therapy and getting great results. We like to use our dear friend and colleague now, Diane Mayes. So she joins us today, and we're going to just really dive in deep as to what it is and what the difference is. So hi, Di. Nice to see you again.
Hi, Karen. Nice to see you too. Thank you for your time.
Oh, thank you. Thank you. So let's just dive right in. We talk about it a lot, but can you sort of start by breaking down and explaining what is PRP?
Okay, well, protein-rich plasma has been used for many years now. It's just a standard treatment where you pretty much extract the plasma from blood once it's been spun in a centrifuge. It's been used for joints, for injuries, for hair loss. It's great for facial rejuvenation. That's standard PRP. But what we'll be talking about today is what I do. That's a little bit different.
Okay, so what do you call your PRP?
Mine's actually, it's in Australia more for dentistry, for bone grafting, the actual equipment, but I used it for you know, facial rejuvenation and for hair loss. So the difference is once the blood has been spun and you've got the plasma, there's three important components. There's the concentrated part, which is called CD34, protein-rich plasma, and then protein-poor plasma. So what I do is extract the CD34 and the protein-rich plasma. I mix it together, and then I actually put it in a special incubator at 43 degrees for 20 minutes. And what that does, it makes it so much more rich with growth factors. So it's equivalent to doing about 10 PRPs. It's very concentrated. And I also, with that, I use 3 tubes of blood. So you get a lot more volume. So it's quite a sophisticated treatment. It's good, of course, for hair loss, 100% good results. It's good for the face. It's a great treatment. Okay,
so it's not just that PRP works, it's been around for a long time. It's how you enhance what you're extracting anyway, and on top of that is the volume of what you use as well.
Yes, yeah. A standard treatment generally is you take 2 tubes of blood, but I find with the scalp it's a larger area. I've been doing 3 tubes for quite some time now, and just with that, as well as using the advanced technique, just getting so much better results. So you can really concentrate and focus on the whole area.
Well, that's really, really exciting. So not only is it more effective, but they need less of the treatments as well. So what have you've shared some before and after photos with me, but what's probably the most amazing thing that you've seen with your technique of PRP?
Well, one thing I'm loving is 100% every client gets a result, every client. So with that, I'm quite busy because every client will rebook, even sometimes beyond the 3 months. 3 months is recommended, about a month. But I'm finding that it seems that people with really bad, especially stress-related alopecia, seem to get quite significant results. So in some ways, especially for women and for men, the worse the hair condition, the better the result. And it's quite significant because it's going from really bad to an improvement. When I'm just focusing on, a little bit at the crown, receding hairline, that's a little bit, you still get there, but it's not as noticeable because it's not so severe, I guess.
Totally understand that. I'm the same, the worse the situation, when you go in and address the underlying causes, you kind of get a better result, but it doesn't mean you don't get a result. It just means it was worse to start with.
Yeah, true, correct, yes.
So I also note with your treatment, you do a lot of extra things, okay? So I've been told that PRP can be very uncomfortable. So what's your difference?
The difference, I really take a lot of time to numb the area. I start with a strong numbing gel, which, I leave, and I put that under a special light for 20 minutes or half an hour, just while the whole process is continuing. And then I actually inject xylocaine into the scalp, which makes it the treatment, that's a little bit painful, the xylocaine, but it completely allows for a pain-free treatment. Because at the end of injecting the PRP into the scalp, I then infuse the remaining protein-poor plasma with the needling device at a high setting. So that would be quite painful as well without the numbing. So it's comfortable.
The numbing technique. Then I note that you're using a laser light, and that's a very effective light on its own. So in essence, they're getting a laser treatment as well.
It's actually more infrared, but what that does, it helps to infuse, not infuse, but it helps to sort of, it just helps the numbing to sort of take effect more adequately, equivalent to occluding it, I suppose, with Glad Wrap, but it softens the scalp. It's just a great starting point, you know, before the treatment, and it's relaxing as well. So a lot of clients, they'll come after work or on their lunch break, they'll fall asleep when they're under the light. So that's enough.
I mean, especially if they're nervous about the treatment, that would help.
Yeah, definitely. Yeah.
And then I've also seen and note that you use, what do you call it, a spin needling device, or you've got a new device as well?
I've got a standard needling device. That's at the end of the treatment where I infuse that. So no part of the plasma isn't used. It's all used. I've got standard needling, and I've now also got the Derma Pen 4, which is kind of like the Rolls Royce of skin needling. So if clients choose to have that option, it's a little bit more expensive because the cartridges are quite expensive and they're disposable.
But it's good to have that option there as well.
Yeah. And I'm finding because it's a more sophisticated device, it's not as uncomfortable as the other one if you didn't have all of that numbing. So it's great for the face. It's great for everything. It's really good.
Oh, that's great. I've seen some great results that you incorporate that with your, let's say, advanced technique of PRP as well. So we said before, frequency, you say to start with 1 every 3 months, and then for maintenance?
I do one a month for 3 months to start with, and I find most clients really start to see a significant improvement after the second treatment, and even then more with the third. So I do advise do a minimum of 3. Once they get to where they want to go with, you know, their improvement, then they can go into maintenance program, probably 1 a quarter. If the hair loss isn't that severe, that would be probably adequate. I do believe you should always do something. You can't get the hair come back and think, oh, this is going to be forever. It's, even though it is permanent, but I think if you're prone to hair loss, I think it wouldn't hurt to just do 1, you know, every 3 or 6 months.
I guess, Di, that's why we work so well together, is you're doing this amazing advanced PRP, whereas I'm coming in diagnosing and addressing the underlying causes. And we've been working together for some time now, and we've seen, you know, the 4-month results. So yes, it does take time to grow hair, and it, you know, it is quite significant what we're achieving, you know, as that combination treatment. So, you know, a great team, I would say. So
yes, it is.
Can we talk a little bit about the pricing of your the normal PRP that we've been doing, and then about the new Derma Pen device you have?
Okay. Because with my hair loss clients, I see them, for me, it feels more medical. I feel that's more a nursing intervention to help. So I just have the price at $600 per treatment, and that's for the 3 tubes, which is a really good price. If they choose to, and that includes the standard skin needling, if they want to have the Derma Pen 4, it would be $650 per treatment, which is still very good.
That's a good pricing. So if someone's interested in having the PRP with you, what would be their first step?
They can call, they can, you can make a booking online, you can book through my Instagram, send a text. There's many ways to get in touch with me. I've got my eyes peeled on everything, so
you're very available. Okay, we'll pop all that information in a link underneath all of this. So what's your, I guess, location and availability?
I'm at Refine Health, which is in Bowen Hills, 22 Campbell Street. I'm there every Monday, Thursday and Friday from really early to really late. And I'm finding with a lot of my hair clients, they do come in after work. So, you know, I'll always have time to squeeze somebody in. Moving forward, perhaps later in the year, if it gets, because it is getting quite busy, I will consider doing an extra day. I'm juggling a couple of, I also do this in Mackay now every second Wednesday, getting really good results up there as well. But yeah.
So that's interesting. So with Mackay, are people traveling a long way?
No, Mackay's actually quite a big town, and the people there are lovely, and they talk because it's the nature of the town. But people are talking and they're booking into Sydney, so it's great.
I've got clients up that way, so hopefully they see this as well.
Okay, good.
That's fantastic. Okay, so we wanted to just cover all of that today. I think we've covered everything that we intended to. So to wrap up, is there anything else you want to add?
Yes, if they do come to see me in Mackay, it's under Brisbane Street Clinic. It's in Brisbane Street, Mackay. So we might need to put that in the link as well. But I'm there every
we'll
week.
look at that. I think they would reach out and contact you first anyway. Because do you normally do a consultation first?
Yes, some people like to just jump straight into it, because usually when they'll send an email or they'll call or whatever, they do always ask questions. Okay. It's not the sort of treatment you can just jump and say, oh yeah, because there's a lot involved and it's not common knowledge. So yeah, most people will go ahead. But then if someone has a lot of questions, which many clients do, consults are completely free. I'd rather people start when they're absolutely sure what they know, what's involved.
No, that's fair. I've found most people have talked to you, by email or on the phone, and they were like ready to jump in. So that was then their first appointment. All right. Well, thanks again for joining me. I think this is valuable information. So we just want to cover up and say that, we do work in combination therapy, and I'm finding that is delivering, outstanding results. That, we do a lot short term in the first 4 months. But then long term, they don't have to do as much as a maintenance, but they have the results.
Yeah, and it's a fantastic combination. It does work well. I guess, the mechanics of it, and you do all of the investigating. So it's great. Yeah.
All right, that's great. Thanks so much, Di. We'll talk soon.
Okay, talk soon. Okay, bye. Bye.